Right, let's begin with the class. So, welcome to first of all, let me welcome you to Let's Crack NEET PG. Right, that's the YouTube channel of Unacademy, their NEET PG division. So, I would like to welcome you to that. This video, it's not a live video; it's going to be a premiered video. So, this video has two parts to it. The first part of the video is the subscription pitch, and after that, you will move on to whatever the content of that video is, whatever I'm going to do. Right? So if you want to skip ahead, you can skip through the subscription pitch, right? Scroll through the taskbar, and you can reach to the end of the subscription pitch where I will be telling you everything about the Unacademy subscription, the Unacademy Plus, and the Unacademy Iconic subscription. And you can skip ahead of that, and you can move ahead to the content. So again, let me welcome you to Let's Crack NEET PG, the YouTube channel. So for the YouTube channel here, you have the top educators, right? So we are the top educators here who are going to be teaching you on Unacademy, and we'll be giving you quality content. And I assure you that this video will be a great learning experience for you all. You might have watched our live videos. Now, during this time, we are uploading these premiered videos, right? And they're recorded sessions for you, which are in a very concise and structured manner, so that whatever we give to you, you can retain it efficiently, right? So learning should never stop. So first of all, if you're wondering who am I, and if you've not watched any of my live sessions or recorded sessions, so my name is Chetanya Mittal. I'm a third semester MBBS student at All India Institute of Medical Sciences, that is AIMS, New Delhi, right? Which might be a dream destination for you. And my All India rank was 4 in the AIMS UG entrance examination, and my All India rank was 5 in the JIPMER entrance examination. As you all know, all of these examinations have been merged under a single name, the NEET examination, the results for which were declared recently. So now it's all as the NEET examination. For the NEET PG, this is the NEET UG examination. And you all know that for NEET PG right now, the exam is the NEET PG examination. Then you have separate exams for AIMS, PGI, and JIPMER. But this year, Central Institutes, they're combining AIMS, PGI, JIPMER, and NIMHANS under a single exam called as the INICET, right? And it is proposed that both of these exams will be replaced by the next exam. The next exam pattern has uh, a lot of clinical weightage, and only around 10% of the weightage goes to pre and paraclinical subjects. So that is about this. And right. So before I move on to the content, I want to tell you about Unacademy. It is my job to tell you about the Unacademy learning app, the Unacademy platform as such, and the Unacademy subscriptions, which are the most useful things for you, right? So first of all, do one thing. No matter what, don't think about any purchases. Don't think about any subscriptions. Just go ahead and download this free Unacademy learning app. Go ahead and install it, and I'll tell you how this will be useful to you, right? This already has over 10 million plus downloads, so don't worry about anything. Just go ahead and install the app. And as you can see, it is the number 3 top free app right now, right? So a lot of people are already using Unacademy to learn. Top educators, including me, are teaching you here, right? You can see that there are a decent number of watch minutes, there are a decent number of followers that are already connected with all of these people. You can see here around at least 12,000 people are connected right now with a few educators, right? And it's a constantly growing thing, all right? So we educators, we are creating structured courses for you on Unacademy Plus, right? So all of these courses, they are plus courses, and as you can see, these are locked, which means that you will be able to access them if you have a plus subscription, right? So you will ask me if your app क्यों download करवा दिया, है ना? So all of these are plus courses. So educators, so for example, if you want to have a complete course on genetic and metabolic errors in pediatrics, right? So you can see that there is a course here which has 6 lessons, pediatrics course here that you can be learning from, right? Similarly, if you want a foundation course, right, which are batch courses, you can see courses such as these. These are batch courses where multiple educators are teaching together for a particular subject, right? Now, the reason I told you to download the app was these special classes. So as you can see here, that educators keep taking free special classes for NEET PG on Unacademy, right? These classes are completely free of cost, and you can all you need is either you can watch them on your laptop, or if you want to watch them on your mobile phone, you can just download the app. Okay, that is why I told you to download the app. So for example, if you want to know what were the questions that were asked for surgery in May AIMS 2020, this is a video for you, right? If you want to know about the embryology of the heart, there's this video for you. I had made a video on basal ganglia, right? You can access my Unacademy profile. I had made a video for arteries of upper limb. You can access this video also directly from there, from the app, right? And once you do that, so you will need my profile for that. So my profile is unacademy.com @ Chetanya Mittal, that's my name. D5-4586. I know it's a little complicated. If you just search my name, you'll still get this there, right? There are not many Chetanyas teaching on Unacademy. So besides that, the benefit of downloading the Unacademy Learning app is that you have the option there to attempt these free mock tests. You have the option to attempt free of cost. These mock tests are absolutely free of cost. And you can see that if you have a plus subscription, these log mock tests, you will never fall short of any kind of questions. So you can attempt all these weekly mock tests as well on the Unacademy Learning app. And there's a comprehensive syllabus coverage. This part A is pre-clinical, part B is paraclinical, and part C is clinical subjects. Besides that, you can see for clinical, you have a higher number of courses because next examination, there is a higher weightage for the clinical pattern. So accordingly, these courses have been made in a very structured way. Besides that, you also have batch courses, right? You have 4 courses now. There might be multiple. This is an old screenshot, right? And you have some courses which are there for your syllabus coverage, for your strategy, for your practice, right? All of that is covered. And this YouTube class is another free class for you, so for you to learn, right? So now, why Unacademy or why online learning is the best way to learn for NEET PG? The reason for that is we are MBBS students. We are very busy people as far as our schedules are concerned. So we need a flexible schedule for anything. We need to have flexibility in our schedules. We need to learn at our own time, at our own place, and at our own pace. All right. So you can see here that on Unacademy, you will have a class running at almost every time, right? Because there are multiple educators. You can watch at your own convenience according to your own schedule. You can watch a lecture recorded. You can watch it unlimited times, right? Then you can be watching in the language of your choice. मैं अभी इंग्लिश में बात कर रहा था, अब मैं हिंदी में भी बात कर सकता हूँ, ठीक है? When we are in a live class, if somebody asks me to repeat something in Hindi, I do that, right? And Malayalam maybe, Tamil maybe, you can basically be learning in any language, and that gets more relevant when you are doing when you're learning something that is from the non-medical portion from the UPSC side, right? And unlimited practice kar sakte ho yaar. You can attempt the quizzes again and again. You can rewatch the recorded sessions. You can also download the PDFs for everything, right? We'll also get all these PDFs on my Telegram channel. That is @NEET PG Chetanya. That's my Telegram channel. You can also join the discussion group where you can ask any of your doubts or you can talk about a subscription. All you have to do is go ahead and download the Unacademy Learning app, and that will feel like you're right in the classroom. You can see that there's a very good chat feature here in the Unacademy app, which I also use in live classes on YouTube, where you can directly chat with the educator. And when we do MCQ classes, I have interactive polls to ask you what is the answer. I would have included questions here had there been a possibility of a live class for this particular lecture, but this lecture is in a recorded way. You can put all your doubts on the Telegram channel for this, and you have the convenience of learning wherever you want, whenever you want, right? So you can be sitting in a metro basically, and you can still be learning. So now there are 2 subscriptions that I want to talk to you about. Very important. Just listen to this part at least. There's a plus course and there is an iconic course. Unacademy Plus basically includes everything that is there on the Unacademy platform, right? You will get all the live classes, access to all live classes and all batch courses, along with the tests and quizzes. Besides that, there is a structured schedule which will be specially made for you, right? And according to that, all the courses are running, for which you will have complete syllabus coverage. You can simply select plus if you want to take the plus subscription. But I will tell you to go a little one step ahead and take the Unacademy Iconic subscription, where you're not getting just Unacademy, you're also getting Prep Ladder. Unacademy is India's largest online learning platform, no doubt. For medical education, what was going so far was Prep Ladder was the leading app, which was acquired by Unacademy. So now Unacademy is giving you both Unacademy and Prep Ladder together. And what you get here is you get everything that is there on Unacademy. And believe me, in 1 year, Unacademy will have lots of great content, right? And right now, Prep Ladder already has teachers like GRG sir for pharmacology. For ortho, you have Apurv Mehra sir, and these are very famous faculty. If you ask anyone for ortho, they'll say, go ahead, take Prep Ladder. For pharma, if you ask anyone, they'll say, go ahead, take Prep Ladder. Similarly, for medicine, for everything, Prep Ladder is a very decent thing for your concepts and subjects. Is to the point, it is concise, right? Unlike some of the other applications. And with Prep Ladder, you get all the video lectures, right? You get all the question banks, the latest question banks, naya question bank aaya hai, along with the rapid revision course. And you also get the notes. Otherwise, these notes are separately for rupees 6,500. If you otherwise try to purchase these notes, they will cost you another 6,500. But here you get these notes included. Okay, so you just go ahead, select the Iconic subscription according to me, and this is the pricing for Iconic, right? So this is the 1 year plan for 55,000. This is the 2 year plan for 77,000. For 3 year plan, it is for 92,000, right? The moment you apply my referral code, that is Chetanya 10. So I'll just tell you there is only one referral code that you have to use on any course on Unacademy. If you are taking a NEET PG subscription, if your brother is taking a UPSC subscription, or if your sister is taking an IIT subscription or a NEET UG subscription, ठीक है, या रेलवे के लिए प्रिपेयर कर रहा है, कोई कैट के लिए प्रिपेयर कर रहा है, उनको बताना एक ही रेफरल कोड यूज करना है, चैतन्य 10. सो इस रेफरल कोड से व्हाट हैपेंस, you get a straight 10% off. You get a straight 10% off. So you can see that it is already reflecting the discounted price to you, right? So this 92,000, the 9,200 got subtracted and this became 82,800. All right. Now, besides that, if you can use credit, so just proceed to pay here. And when you do that, I will show you here. There's an option to apply credits. There's an option to apply credits. And if you contact me, I'll tell you exactly how to do that. And if you maximize your advantage, you can get a 10% off using credits as well. Just click apply. And if you use my referral code, the best advantage of using my referral code is you will also get a cashback from my end, right? And this cashback from my end, you can claim by texting me on Instagram at the rate chatanya.blue. That is my Instagram ID. And you can also get to me on my discussion channel on Telegram, that is at the rate NEET PG Chetanya, right? Just contact me beforehand before taking a subscription. Make sure you're a new user. Make sure you're a new user. You have a new account, right? And all you have to do is enter the referral code, apply the credits. You will also get the additional cashback. So basically, what happens is this course that costs you for 82,800. If you apply credits, right, there's a further discount of 8,000. And if with my cashback, this course will come down to 75,000 or 70,000 for you. All right. And that is really, really cheap, as you can already make out. I'll just show you the calculations. 75,000 for 3 years, and you also get 2 apps, right? So that is basically 12.5 thousand per year per app. Now, what can be cheaper than this? If you compare it to offline NEET UG coachings, which you might have taken previously, okay, that would have costed you somewhere around 1.5 lakhs per year, है ना? या फिर 1.25 lakh per year if you had some scholarship. This is almost 10 times less. This is 10 times less, and you are getting the best of both worlds. All right. So I would say go ahead, take the Iconic subscription. If you are satisfied with Unacademy, you don't want to go ahead with Prep Ladder, just take the Unacademy Plus subscription. Does not matter. And then here you will get the different pricing. For 3 years, this will cost you 50,000, right? So that was an extra around 40,000 for Prep Ladder. So Unacademy Plus is a little more expensive than Prep Ladder otherwise, because there's a difference in the content, there's a difference in the number of educators that is there, right? So there's that. And then here the referral code is Chetanya 10. Same referral code works everywhere, and you'll get a 10% off the credits and the cashback. Everything still stands, right? You know how to reach me. On Telegram, just you'll go and you'll join the channel, you'll subscribe the channel, and there's an option to join the discussion group. Just come there and you can find me and text me. Alright, otherwise Instagram works as well. So apply कर दिया, referral code apply हो जाएगा, discount मिल जाएगा, credits लग जाएंगे. Yeah, so this was a comparison of the pricing. I just wanted to show you that this for 3 years after discount is 45,000. After discount, this is around 80,800, which will come down to 70,000 if you are able to use your credits well. Yeah, and I will give you some part of it through a cashback via Paytm or Google. Right. So today's lecture is a very short one. We're going to be doing nerve supply of the pleura, nerve, supply of the pleura. So what is pleura? Pleura is the covering of your lung, and as you all know, the pleura is made up of two parts: your parietal pleura and your pulmonary pleura, also known as the visceral pleura, right? So either you can write it as pulmonary. More frequently, you will see it written as visceral pleura, right? So why do we discuss the nerve supply of the pleura? Because it has some clinical significance, and the nerve supply of the pleura by itself is a very important topic. My name is Chetanya Mittal. I'm a third semester MBBS student at All India Institute of Medical Sciences, that is AIMS, New Delhi. Right. So we'll discuss the nerve supplies of the parietal and the pulmonary pleura respectively. We'll compare the two, right? And I will do it in a very short and summarized manner so that what I wish to tell you goes into your head in a very clear and targeted way, right? Now, before we talk about the nerve supply of the pleura, it is a little important for me to explain to you how the pleura is divided. Like, what are the various parts of the pleura, right? So, the pleura can be said to be made up of four, it can be divided into four parts based on where it is present, where it is reflected, right? So, as you know, the lung, it extends a little above the first rib, right? You know the lung, there is some part of the lung which extends into the root of the neck, right? So there is some layer of pleura present over it, right? So that pleura first is labeled as the cervical pleura. That pleura is labeled as the cervical pleura. Some of it will be facing towards the inside, some of it will be facing towards the outside. Then you have this pleura which is present against the rib cage, right? Which is present against the rib cage. That is known as the costal pleura. That is known as the costal pleura. It will be present in the internal intercostal spaces along the ribs and everything along the muscles, right? So that is the costal pleura. Then there is some part of the pleura that will face inwards and it will lie along the various organs and the various structures present in the mediastinum, right? Example, the heart. So the pleura that lies along the mediastinum, that faces towards the mediastinum, reflects along the mediastinum, that is known as the mediastinal pleura. And finally, the pleura that reflects along the diaphragm, this is known as a diaphragmatic pleura, right? Now, why this is important to know? Because they have a kind of a different nerve supply, right? So approximately this part you can consider as the central part of the diaphragmatic pleura, and then there is some part which will be the peripheral part of the diaphragmatic pleura. There is a central part of the diaphragmatic pleura and there is a peripheral part of the diaphragmatic, right? There's no clear-cut demarcation. It's just a general idea that there is a central part and then there is a peripheral part. All right. Now, when you move to the nerve supply, you will first of all segregate the parietal pleura and you will segregate it from the pulmonary or the visceral pleura. That's the first thing, right? Why do they have different nerve supplies? Because they have different embryonic origins. So I'll just take a different color. Black. You can make out here the first point, the parietal pleura for an embryo from an embryological perspective. Both of them they developed from the lateral plate mesoderm. Both of them developed from the lateral plate mesoderm. Alright, so that much is correct for both. But as you know, the lateral plate mesoderm, it has two layers. One is the somatopleuric layer, the other is the splanchnopluric layer. So as you can make out, this is related to the visceral surface, and this is obviously related to the somatic or the outer surface. So the nerve supply of the parietal pleura, because of its embryological origin, is different from the visceral nerve supply. The visceral nerve supply is obviously through the autonomic nerves, right? And the nerve supply of the parietal pleura is through the somatic nerves. As you know, visceral organs, they are pain insensitive. Visceral organs are pain insensitive. So that much you can make out from here. So let me just write that down again. 1 and number 2 and number 3. So basically the parietal pleura, it is supplied by the somatic nerve, so it is sensitive to pain, it is sensitive to pressure, it is sensitive to touch, it is sensitive to temperature. But what is relevant here is pain sensitive and pain insensitive. It is sensitive to stretch, but it is insensitive to pain. Alright? Like any visceral organ, they're sensitive to distension, but they're not sensitive to pain. They're not having pain sensation. So let's talk about the nerve supply of the parietal pleura.
and then we'll go to the visceral pleura. For the parietal pleura, I told you there is a costal part, there is a mediastinal part, and there is a diaphragmatic part. Let's include the cervical part into the costal part only, right? So just think of this: the part that is costal, right? That is going to be supplied by obviously your intercostal nerves, which will be present here by the respective intercostal nerve segmentally arranged. You will have the costal and the cervical. The cervical, let's include it in the costal. So the costal will be supplied by the respective intercostal nerves. Very obvious, the intercostal nerves are running, they will supply the pleura. And there are this peripheral part of the diaphragmatic pleura. It is also supplied by the intercostal nerves, by the lower six intercostal nerves, right? By the lower six intercostal nerves. So both of these, they are supplied by the intercostal nerves. Now what is left is the central part. What is left here is the central part of the diaphragmatic pleura, right? And the mediastinal pleura. Now they must be supplied by a structure that is present inward, that is present more deep, that is present in the inner layers, right? So there was a nerve that was descending here from the brachial plexus, right? And that was the phrenic nerve. That was the phrenic nerve, right? In the mediastinum, there was a nerve coming that was known as the phrenic nerve, which will supply the diaphragm. So it will also supply the pleura that reflects over the diaphragm. That is along the central portion of the diaphragm. So that is the central part of the diaphragmatic pleura. Remember, the peripheral part of the diaphragmatic pleura is being supplied by the lower six intercostals. Whereas the central part of the diaphragmatic pleura is being supplied by the phrenic nerve. Main root value is C4. Do remember that the main root value of the phrenic nerve is C4. And along with that, it will also supply the mediastinal pleura on its way. So that's very simple. The mediastinal pleura and the central part of the diaphragmatic pleura, they're supplied by the phrenic nerve, root value is C4. And the costal pleura is supplied by its respective intercostal nerve. The lower six intercostal nerves will also supply the peripheral diaphragmatic pleura. Right? Now, when you talk about visceral pleura, like I told you, it is supplied by autonomic nerves. Autonomic will have a sympathetic innervation and a parasympathetic innervation. Most of the organs in the thorax, they will be having a parasympathetic innervation from the vagus, right? So as you know, the vagus supplies the parasympathetic till uh, the transverse two-third of the colon, right? So that's about the parasympathetic supply, right? So the vagus is going to be supplying here, right? There is no doubt about it that the vagus will supply the visceral pleura in the parasympathetic innervation. The sympathetic innervation comes from the second thoracic to the fifth thoracic, right? The sympathetic is the thoracal lumbar outflow. So T2 to T5 will be the sympathetic root values. And what about the nerves? These nerves, as you know, the sympathetic and the parasympathetic innervation. So vagus by itself, whereas the sympathetic nerves, they usually accompany some vessels, and usually these nerves, they distribute themselves through the bronchial vessels. So these nerves, they are accompanying the. So that is about the nerve supply of the parietal pleura and the nerve supply of the visceral pleura. So now what was the significance? So that's about the anatomical part. Let's move a little bit to the applied portion or the clinical pearl. That is regarding pleuritic chest pain. Pleuritic chest pain, things that you should know about it is the character, right? So whenever you talk about any pain, you describe it in the history by all of these things: site, onset, character, radiation, etc. So character of the pleuritic chest pain, remember, it is sudden, intense, sharp, stabbing, burning pain in the chest, right? And it is uh, exasperated during deep breathing and inhaling, because when you're inhaling, your pleura stretches. So it will be more when your pleura is stretching, when you're inhaling, when you're taking deep breaths, or coughing, or sneezing, or laughing. That will be the time when it will be more. So these are the exasperating factors, right? So that is the E here. You should know about the C, you should know about the E of pleuritic chest pain, right? And there is also relieving factors, right? The aspirating factor, relieving factor is sometimes if it is due to pericarditis, then it is relieved by leaning forward, right? So there are relieving factors. It will depend on which side of the pleura is inflamed, which site of the pleura is inflamed, right? And if it occurs near the diaphragm, as you know, it can be referred to the neck or the shoulder because of the similar innervation. You know that the pain of the diaphragm, it is referred to the neck or the shoulder. That is regarding the R, that is the radiation, is the radiation, right? So there are a lot of characters related to the pleuritic chest pain that you should be aware of. So that is why I was describing it to you a little, and that will probably be helpful when you come to your medicine portion as well, right? So that is about this much regarding the nerve supply of the pleura, the pleuritic chest pain, and the pleuritic chest pain, one of the most common causes is pulmonary embolism, right? So this is a table that you should probably have on your fingertips, especially the part about these the pain insensitive and sensitive part. You should be very thorough with that, right? So, so if you guys like this lecture, it was a very short and concise summary of everything. Do drop a comment, do hit the like button, right? And do press the subscribe button for the YouTube channel Let's Crack NEET PG, Unacademy's YouTube channel for the NEET PG division. And you guys know about my referral code, that is Chetanya10, and you will get a 10% off. You will also get the benefit through credits, and you will also get a cashback from my end, for which you can contact me on Instagram. My Instagram handle is @chetanya.blue, and you can also join my Telegram channel, that is @NEETPGChetanya, where you will find all of these PDFs. You will find the links to new lectures, and you can also join the discussion group. You can ask your doubts. Since this is a recorded lecture, I cannot be taking your live doubts, but you can ask your doubts there, and you can be asking me about the Unacademy subscription. Do hit the bell icon for notifications so that you know which educator is live when, and take the maximum advantage of all these free live and recorded premieres, right? Thank you so much for watching. I hope this lecture was useful.